you saw me going, but there was nothing coming out on the sound. But you know what we do in behavioral health? We just roll with things. That's what we do because we are resilient. So I'll briefly cover a little bit of what I said. I wanted to welcome those of you who are new to the department. I'm Susan Holt, the director of DBH, and also serve as our public guardian. And for those of you who are not new to the department or to this broadcast, welcome back in the new year. Happy 2024. So we do start our broadcasts with acknowledgements most of the time if it's the start of a new month. And so I wanted to wish everyone a happy new year. And in particular, I wanted to acknowledge that the start of a new year is celebrated differently within cultures. And so I wanted to express a happy new year to those who celebrate in a cultural context, and also note that the start of the new year doesn't always fall on January 1st in different cultures. So happy new year across this extended period of time. Also want to acknowledge the very important holiday observance ahead coming this Monday, next week, Martin Luther King Jr. Day. This is a really important day for all of us across the nation to acknowledge the many contributions of Dr. Martin Luther King and his contributions as an activist, a leader, and really achieving greatness across the United States. In particular, some notable acts passed really directly attributable to Dr. King were the Civil Rights Act and the Voting Rights Act. So I hope everyone is able to spend a little time in reflection on our holiday on Monday. And then the last acknowledgement for January is Mental Wellness Month. Of course, in behavioral health, this is a significant month for us because that's what we focus on all the time. But really, a mental wellness month is for all of us. Anyone can take this month as an opportunity to reflect, take stock and inventory of your wellness tools, and then think about ways that we can increase our overall well-being. Moving to the next slide, we have updates from our colleagues in the Department of Behavioral Health Human Resources team. A big shout out to Gagan Tour, our program manager in the Human Resources team. I was going to say borrowed his content. I pretty much took all of his content directly. He did a training in service for all of the supervisors across the department this week. And I really liked the content that he and his team members produced, so I wanted to share that with you all. I believe it was also Marcus from the DBH Human Resources team who was part of that presentation. So shout out to both of them, and thank you for allowing me to borrow your content. So the first update there is there's a new benefit here in the state of California that was signed into law effective January 1st. For individuals who've experienced a reproductive loss, there's a new benefit for unpaid protected time up to 5 days. This is for qualifying reproductive loss events, and I'll go over those in just a moment. It is unpaid leave time, but in the county we have a benefit package of paid annual leave, vacation days in other words. If a person wanted to be paid for those leave days in our department, we would code that as annual leave, but on your timesheet there will be a special project code. You don't have to remember that today, but we would acknowledge through your timesheet that it's protected time. Those reproductive loss days don't have to be taken all at once. They could be non-consecutive, but need to be utilized within 3 months of that qualifying event. The qualifying events could be things, I want to make sure I read this accurately, such as a failed adoption, a failed surrogacy, a miscarriage, a stillbirth, or an unsuccessful assisted reproduction. And so if you have one of these qualifying events and want to make use of this new benefit in California for protected time off, please do alert your supervisor, and of course always feel supported to reach out to DBH Human Resources. They really are experts in this arena, and they'll be more than happy to answer questions or provide guidance. Next update, still in the same slide, is that the County of Fresno has made changes to the management directive, which governs the use of personal vehicles for travel during work time. So if you are going out into the field to deliver services, or if you've got to drive across town to attend a meeting, the previous management directive had a higher insurance requirement than the minimum required by law in California. And our county leadership has decided to align our policy as a county with the minimum requirements in the California Vehicle Code. So that's exciting news for us, because the barriers to being able to participate in field-based services or attending various meetings are reduced. So utilizing your own personal vehicle does still require you to have supervisor approval and meet the minimum requirements, which now, as I mentioned, are the same as the California requirements. So hopefully that's helpful for some of our team members. From our Human Resources team, also a couple of updates related to COVID. With the start of the new year, there are some COVID-19 regulations that are sunsetting. Most of those don't impact us here in the Department of Behavioral Health, but there is at least one little change I wanted to alert you all to. One thing that's not changing is we do want everyone to continue to utilize the screening questions, the employee screening questions. You can do that on the app. I do that on my phone. I try to be pretty diligent about that. Every once in a while, full transparency, every once in a while I do forget, but I try really hard, and I hope you do too, to remember to do that daily. That's important because if there's a close contact, if a person is identified having been here in the workplace COVID positive, we need to be able to notify persons who were a close contact. Those notifications will continue to go out from our DBH Human Resources team members, but the change I wanted to alert you to is that the team will no longer be sending building-wide notifications if someone was in the building who later was determined to have COVID. So those building-wide notifications of the presence of someone who had COVID will cease to happen. If there's a minor outbreak or a major outbreak, building notifications, in other words, a notification to everyone whose work site is within that building, those will continue to happen because those notifications include specific instructions related to masking, for example. So the last update from our colleagues in Human Resources is just to remind everyone that we do have supportive processes in place for our transitioning and transgender team members here in the Department of Behavioral Health. It's really important to let all of you know that we have provided training to our supervisors across the department to make sure that we are supporting our individuals, and also the Human Resources team is available to support those team members directly. And I'd encourage anyone in the department who's transitioning or transgender who wants more information, or any supervisors or colleagues who would like more information, to ensure we have our cultural humility and skills very high, to reach out to Human Resources. All of us in our workplace have rights available to us. We should all make sure that we're respectful of one another, and our DBH Human Resources team is more than happy to share all of that information. One update came through just this morning, and I wanted to make sure to share with all of you. I was participating in a statewide call subsequent to the governor's announcement of the January California budget release. So I included on this slide a link. Those of you who are really interested in lots of details, if you find budgets and fiscal information really interesting, you can look at the California budget on the website starting at ebudget.ca.gov. So that's where you can go if you're a person who likes a lot of input and you want to read a lot of the details. But in summary, the outlook from the governor's perspective is a little brighter than folks were speculating. The Legislative Analyst's Office, based on a variety of factors over the months leading up toward the winter, had predicted a $68 billion deficit for California. But based on newer information and some hot off the presses fiscal analysis, the governor's perspective is, as I mentioned, much more bright. The deficit that he is working with is at $37.86 billion, which of course you can see is significantly less. But it is still a deficit. So the governor has, in his press conference, really worked hard to assure all of us as Californians that we are resilient, and he sees this deficit as a recovery phase, and he is very hopeful about the fiscal future of the state. And he has proposed 3 layers of solutions to help California weather this storm, if you will, to pull out of this period of a deficit and to continue to grow and thrive. Without going into a lot of detail, you can see the detail in the press conference. If you're interested, you can go to the governor's YouTube page for more information. But in a nutshell, one of the strategies the state will employ in order to fare through this deficit phase is what the governor is calling budget resilience. This is tapping into the state reserves, focusing on state revenue, and some level of borrowing. The next solution the governor proposes is the category of belt tightening and stretching dollars. And so he described some reductions and some shifting of funds. And then the third category of solutions was described as delays or deferrals. And one example of a delay that affects us in the Department of Behavioral Health is that the Behavioral Health Continuum Infrastructure Program, which is a grant program to fund capital projects to build out infrastructure. The round 6 of that funding is delayed. We were literally waiting for the release of the request for applications. It was supposed to be out yesterday, but the governor has decided to prudently delay that release for another fiscal year in order to get through this economic recovery phase. One of the things I think that's really exciting and hopeful for us is that in the governor's budget, behavioral health funding is largely preserved. And in fact, the governor was very vocal and clear that investments in behavioral health remain a top priority. He was also very clear that investing in addressing the crisis related to our unhoused population across the state is also a high priority. So I wanted to share that with all of you because I know that there's a lot of information circulating in the media about the state budget deficit, and I'm feeling very hopeful for those of us in the behavioral health field and county behavioral health in particular that we should be faring pretty well through this next fiscal year. Now, that doesn't say that it's going to be, all sunshine and roses. With the government focusing on some belt tightening, there may be some trickle down to counties that we'll want to be on the lookout for. And certainly there are other local factors that we'll be looking for, and I'll commit to continue to report out to all of you if there's any concerns related to our budget as we move into the season where our division manager over finance, Sean Patterson, and our deputy director, Marianne Lee, will be leading us through the budget preparation phase actually pretty soon. So more to follow on that, but I wanted to assure all of you that I'm feeling quite hopeful about the state budget for behavioral health. I wanted to give you another update, and this is about a new state mandate. So this is a mobile crisis benefit for individuals with Medi-Cal, and California counties were mandated to implement a mobile crisis program according to some very strict criteria, and it was to launch December 31st. And if counties did not have all of the program parameters met, they would be out of compliance with the state of California. So in DBH here in Fresno County, we've had a crisis intervention team that does mobile response for many, many years. Our colleagues with Kingsview operate most of that field-based crisis response, and we have a county-operated team that works in collaboration with our partners in law enforcement and Kingsview. So then what's new? The part that's new is that our crisis intervention team model is that we respond out with law enforcement. So the crisis responder would be dispatched as one responder to meet an officer in the community, whether it be at a person's home, out at a business or a street corner, or wherever a person in crisis may be. The mandate for the new crisis model requires the response option without law enforcement. So based on a screening process and an algorithm to determine risk, a team of at least 2 would be deployed out into the community without law enforcement present. So that screening and risk assessment algorithm by phone would be to eliminate obvious risks to determine that it's safer to send a non-law enforcement response. If it's determined in that screening process that there's weapons on scene or that there's other safety risk factors, a mobile crisis team could go out in conjunction with law enforcement. So the part without law enforcement is a new variable for us. And then there's another part that's new. Our current crisis intervention team model has been from 6 a.m. to midnight. But the mandate requires 24/7, 365. So that midnight to 6 a.m. is completely new for Fresno County. And as I mentioned, it was a mandate for December 31st of 2023. We had to have all of our minimum program operational. So we did it. We are live with 24/7 mobile crisis. I want to tell you how we did that, because we were not successful in taking our contract amendment to the Board of Supervisors to approve the expansion. There was a variety of circumstances that resulted in us not being able to finalize that in order to get it to the board before January started. So that's slated to go before the board on Tuesday of next week. But that's not, not next week, the week after, sorry, the 23rd. My days are all jumbled. So we had a situation where we had this mandate and we were at risk of being out of compliance if we didn't cover from midnight to 6 a.m. and if we didn't have a non-law enforcement response available. But we didn't have the ability to have our contract up and live. So I really want to give a huge shout out to Senior Analyst Earliana Vang and Deputy Director Dr. Emma Rasmussen. It was very late in the day, kind of 11th hour, and they came to me to say, this is not going to make it to the board in time. And we slowed down and we sat together in thought and said, what's within our control? What could we do? And through some collaborating and thinking about what options were out there, they came up with a plan, and we were able to be in compliance with the state by partnering with our contractor, a variety of department team members, and the executive team included in that, and we created a strategy to provide the coverage. So until our contract is amended for Kingsview to fully do the 24/7, the day shift is covered as a hybrid. The non-law enforcement response is a hybrid of the Kingsview contractor staff and DBH team member staff. So there's a handful of DBH team members. I won't name them all by name. They were able to reprioritize their work duties to take the mandatory training. I believe it was about 18 hours of training, and so they worked with their supervisors, and one of our managers also did the training as well. One or more of our managers did the training. And so I really appreciate all of you juggling your work duties. I know we're all stretched thin, but folks made that a priority. And then the midnight to 6 a.m. shift is covered by the deputy directors, Dr. Rasmussen, Dr. Lesby Castro-Flores, Dr. Marcelia Black, my apologies, Marcy, and Senior Analyst Earliana Vang, and I am their backup. So all of us also took that 18 hours of training. Many of us sacrificed our personal time and vacation time to do it, not because anyone told us to, but because we chose to, because it was exciting and interesting and something that we felt committed to do. And so we are the coverage team on call midnight to 6 a.m. Super excited to report we had our very first overnight crisis call just last night. So Dr. Castro Flores and Marcelia Black were the on-call team last night, and at 4:31 in the morning, the call came in. They packed up their go bag and they hit the road together and went out into our community in person to a person in crisis. So I'm super proud of the Department of Behavioral Health and our leadership for putting together a plan to serve our community. And what we're doing through the month of January during this soft launch time is we're doing debriefings to really capitalize on the learning from this early phase of implementation. And then we'll build on the lessons learned as we prepare for the next steps. So once our contract amendment expansion is approved, our contractor will take over that 24/7 field response, and our county team will support in partnership. So where we're at right now in planning is, as I mentioned, we're learning as we go. We'll have a presentation prepared for either a director's update in the future or perhaps at an all-staff meeting to go into a lot more detail about this new mobile crisis service. And then we're doing a full court media campaign under the direction of Ahmad Barami and obviously Brian Bishop, leading the charge with many other team members in the public behavioral health team. So we'll be advertising the mobile crisis number, putting that in all of our print materials, making sure that all of you in the department and our community understand the benefit and know how to access it. So we'll learn as we go and integrate this new service into our department's great work. And then a quick update on the Department of Behavioral Health reorganization. A very short update today. Probably next time we'll have a more robust update from one of our project leads. But the task group is meeting regularly, as we've committed that they will do. They have drafted and approved a charter that guides their work. They've determined that to help measure our outcomes of this reorganization, we want to make sure that we have Department of Behavioral Health employee feedback on how we're doing, and so we will be embedding a question about that in the Gallup survey so that we fulfill our commitment to you all to hear from you and take action on your feedback. We know that communication has been consistently raised as one of the top priorities for all of you, and so the task force meetings will follow with department-wide communication, and the next meeting is scheduled for next week, the 16th. I'm laughing at myself because that's next Tuesday, and the Tuesday after is the 23rd. So after that meeting next week, that team will send out a written communication. And then lastly, the team is building out an FAQ document, or a frequently asked questions document. This again is another tool for communication, and they are building that right now, so that's not ready for publication yet, but they're building that inventory of frequently asked questions. A few of the questions received so far are things like, will programs be able to ask for additional positions? Will anyone supervising a program lose positions? Is there control for an employee about what area of the department they end up in? Or where will I end up in is a frequently asked question. And then how will decisions be made and by what criteria? So if you want to be part of building this frequently asked questions list, which will of course populate the answers to as that gets developed, please go ahead and email Dr. Rasmussen and Marcelia Black with those questions to be added to that frequently asked questions document. So that is it for my update on reorganization. And I have just a tiny bit left for you. I know I'm up against the clock. I have 4 themes of focus that I personally am focusing on for the department in 2024. One of the things I'm professionally working on is to communicate more of the vision to all of you so that you see kind of where my head is As we have begun to start our reorganization, it's allowed me to delegate to many of you and step into more of that strategic vision role of a department head. And so I'm focusing on 4 key themes. It's not excluding other things, but it's sort of the umbrella, if you will. And the first is organizational well-being and employee engagement. You hear that a lot from me already, and you will continue to hear that from me because I am unwaveringly committed to supporting all of us, all of you, in thriving and being well in the workplace. So we are continuing action-focused attention and communication and really working on cohesion, trust, culture of high standards, and also a culture of supporting one another and accountability. So I want to assure all of you that your quality improvement coordinator, Jeff Elliott, and his whole team are holding me accountable because number one, it's the right thing to do. That's part of their job. And number two, I've encouraged them to do so. We all get busy in our day-to-day work, and there's a risk that when we're really busy with so many priorities, maybe something gets pushed to the back burner. I don't want your well-being as an organization to get pushed to a back burner. It's critically important to all of us, and so I'm asking them to hold me accountable. So you can reach out to them and support them in doing that. The next theme is integration. It's really important to us to integrate our care and also integrate our administrative and clinical work. That's part of what you see with our reorganization plan is the integration of mental health and substance use disorders, the integration of administrative functions and clinical functions. And so we will continue that integration focus and theme as we move forward. This also aligns with the direction that healthcare is going in the state. And so part of that integration is also integrating with our managed care plan partners who oversee the rest of the Medi-Cal beneficiary healthcare system and integrating with our community partners as well. So lots of opportunities there. And then the last 2 areas are kind of connected. The third is assess and respond. So as we are going through so many new changes and as we continue to have more change ahead from the state, we're going to be very intentional about how we assess the performance of our department and how we respond. So we will be focusing in the months ahead on how we evaluate our work. That might include things like fiscal audits. We already do chart reviews and such for the care that we deliver. We have a great team that does that already, so we will be building on those successes. There will be some needs assessments. I know we've done community needs assessments with the planning team under the public behavioral health team, workforce assessments also, learning from all of you what you need. And then we talked recently about participating as a department in the Lean Six Sigma pilot for quality improvement, and so we'll utilize that as part of our response as well. The executive team will be meeting with leaders across the department more regularly to review their lines of work. I call that a business line review. We've done that with some areas, but not all, and I hope to expand that as a support to the whole team here in the department. And really importantly, when I say assess and respond, I mean correct if we have to correct, but let's celebrate where we have victories. When we evaluate something and find that we are rock stars, we're gonna go whoop whoop, we're gonna celebrate our victories, and then we're gonna promote those best practices and share that learning. And so that's what I'm really excited about for assessing and evaluating our work. And then the fourth area that I'm focusing on for all of the reasons I just mentioned and more is adaptability. The healthcare environment is rapidly changing, and there will be continued state regulation changes. And so with those things in mind, I want to continue to focus on communication because I think that's an essential component of adaptability. And then I want to make sure that we're creating that culture of supporting one another through these stormy times. So those are the 4 things that I'm focusing on that I wanted to share with all of you. And I'm slightly over time, so we'll very quickly go over my January reflections. I do try to include once in a while a getting to know Susan component. And so I have a little quote here from Vivian Green that says, "Life isn't about waiting for the storm to pass. It's about learning to dance in the rain." And the reason I included this is 2 things. Number 1, Roxy, my dog, the bigger dog that you see in the photograph on the right, and in the photograph on the left, you see her little face. She got a raincoat for Christmas from my aunt, and I thought it was hilarious. And it was building on some hilarity from a year prior when my little dog Peanut, whom you've heard me talk about before, who was gravely ill recently, she also has a raincoat. So I took them out walking in the rain the other night, and I started thinking about how sometimes I have chosen to avoid life's challenges because it's hard, and I was really, as I am often in the winter time, feeling very reflective. And one of my goals is to start embracing my challenges and actually just embracing every moment. So I really want to focus on looking at life as it comes and not avoiding things that are tough or hard, acknowledging when they are. I was joking with some colleagues that, sometimes things kind of stink. It's like, oh, this stinks, or this isn't fun. And that's okay to say. And it's also okay to say, and this is my experience in this moment, and I'm going to just embrace it. I'm just going to be with it, sit with it. And so I wanted to share that with all of you because that's kind of where my head is right now personally. I have a few little health things going on, nothing to worry about. It's mostly just age-related creaky joints and such, but it's causing me to reflect on focusing on what I can do, not what I can't do, and then also thinking about my goals for the future. So a little bit of a embracing 2 things at once, that dialectical thinking of I'm going to embrace this moment for everything that it is, good, bad, or indifferent, and I'm going to stay present in my goals as well. So that's a little bit about my reflections of where my head's at. And I'm slightly long, but I'll open it up for questions. If you have any questions and you're not on YouTube, you're welcome to email Christina Young. I don't see anything in the YouTube chat, but we'll give it just a sec. I'll check if Tina has sent me any questions. Nothing so far. We'll give it just a sec, but I'll use that little sec to thank you for everything that you do and to wish everyone a very, very happy new year. I hope 24 is starting off well for you. I know that each of us has a life outside of DBH. Many of you I know are going through very difficult things. I've had many conversations just in the last few days with different team members who've shared with me trials and tribulations, illnesses, losses, traumas, also milestones and victories and celebrations. And so I know that when you're here with us, it's just a sliver of your life, and I hope you're well. No questions on YouTube, and I see one smiley face coming from Tina, and she says no questions. So we'll wrap it up there. I did go a little long today. My apologies for taking up more of your time, but I'll see you next time.